English test, listening test. This test has two parts. Part A. In this part of the test, you will hear a general practitioner talking to Mary, a woman with stomach pain. You will hear the consultation once only in sections. As you listen, you must make notes about the consultation under the headings given on the answer paper. Turn over now and look quickly through Part A. You have 1 minute to do this. You must give as much relevant information as you can under each of the headings provided. You may write as you listen, and there will be pauses during the consultation for you to complete your notes under the relevant heading and to read the following heading. There will also be 2 minutes at the end of the test for you to check your answers. Give your answers in note form. Don't waste time writing full sentences. Remember, you will hear the consultation once only, and you should write as you listen. Now look at question 1. Question 1 has been done for you.
Good morning. My name's Dr. Neil Walsh. Can I begin with your name, please?
Hi, Dr. Walsh. I'm Mary Higgins.
Hi, welcome, Mary. And can you tell me what brought you here today?
Yeah, sure. It's my stomach, actually. Recently I've been experiencing some pain and also what I think is heartburn.
Now look at question 2. Take notes on the general history of Mary's problem.
Okay. So when you say recently, how long have you had this problem?
To be honest, probably around 2 months now.
Right. And have you experienced anything like this before?
Not this severe, no. I've had some stomach pain before, of course, but nothing that's lasted more than a couple of days at the most.
And when do you feel the pain the most?
Generally after eating, I'd say, and sometimes when I'm going to the toilet too.
I see. Okay. And in that last 2 months, have you eaten anything different or unusually heavy?
No.
Have you travelled abroad at all?
I was in Thailand on business, but I didn't really leave the hotel. Only to a few conference rooms and always ate at the hotel too.
Okay, well that is still a possibility then, so it's something we will need to consider.
Now look at question 3. Take notes on any family-related history and the doctor's explanation.
Can I ask about your family? Does anyone have any type of gastrointestinal disorders or bowel complications?
Well, actually, my husband's brother has Crohn's disease. I know that's not the immediate family, so there are no genetic issues there, but still the thought is always there, you know.
I can understand your concern. Often when we know someone close with a problem such as that, we can't help but harbour the suspicion that perhaps it's possible. You're right that there's no risk of genetic issues if it's outside the bloodline, and Crohn's is in fact largely related to genetics. But often Crohn's is accompanied by fever, porridge-like diarrhea and weight loss. So your current symptoms don't seem to be heading down that particular path.
Oh, well, that's good news.
So there are no other issues in your family history that you can think of?
No, nothing apart from my brother-in-law's illness.
Now look at question 4. Take notes on Mary's pain and the nature of her symptoms.
How strong is the pain itself after reading? Let's say on a scale of 1 to 10, where 1 is very little pain and 10 being severe, how would you rate your pain?
I guess around 6 to 7 when it's at its worst.
And is the pain continuous or is it on and off?
It seems to just come and go. Sometimes it can last into the night though, but especially after eating.
You said it's worse after reading. Can you think of any particular food that might set it off?
Well, my diet hasn't been the best of late. I'd have to say greasy food is probably the main culprit.
Okay, and where in the abdomen do you feel the most pain?
Just around the middle of my belly.
And does the pain travel anywhere else? Say, for example, to your chest or shoulder or across your back?
No, only in my stomach. Sometimes it feels like it moves across my stomach.
Now look at question 5. Take notes on the details of Mary's heartburn.
And you also mentioned that you've had some heartburn.
Yes, after I eat, I feel it travel up, but it tastes kind of sour in my throat, especially if I burp.
Is that more prominent in the mornings or evenings?
Both, actually.
Do you notice if it becomes stronger when lying down?
Yes, it does. I can taste the acidity in my mouth. It's an awful taste, and it kind of makes me feel a bit sick every time I swallow.
Okay, so apart from greasy food, is there any other kind of food that can irritate your stomach? For example, do you eat a lot of spicy food?
No, I hate spicy food. I've never been able to tolerate it actually, so I wouldn't know if it makes any difference. I'm sorry.
Now look at question 6. Take notes on the details of Mary's bowel habits.
Alright, so now I need to ask a few personal questions. Are you okay with that?
Yes, of course.
You mentioned that it sometimes hurts your belly when you're going to the toilet. Are your bowel movements regular?
I'm pretty regular, I guess.
Has there been any change in regularity since the pain began?
It hasn't really changed since the problem started. Sometimes I go to the toilet twice in a day. Is that normal?
That's perfectly normal, yes. It just depends on how much you've eaten, that's all. Have you noticed any change in consistency or colour?
Well, I think it might actually be a little bit softer these days. And as for the colour, it might sound a bit strange, but it seems to be a bit green.
So, greener, not darker?
No, it's not darker, it's just kind of greenish.
And have you noticed any blood in the stool?
No, definitely not. If I'd noticed blood, I would have come to see you much sooner. Well, I hope I would have.
I'm sure you would. But sometimes people know there's such a symptom but are too embarrassed to tell anyone.
Oh no, not me. Embarrassment is one thing, but blood is quite another.
Now look at question 7. Take notes on Mary's eating patterns and current medications.
Okay, so what we can do first then is to check your abdomen and try to isolate from where the pain is originating. So just to clarify, you said earlier that the pain was coming from the middle of your stomach, is that correct?
That's correct, yes.
And it usually stays there, but sometimes circles around the belly area. But with the pain, do you also notice the acidity?
Usually, yes.
Any nausea or vomiting?
No, not at all.
Okay, so can you tell me what you've eaten today?
Well, as I mentioned, I do like greasy food. I guess you could call it junk food, but today I only had a tomato-based pasta with some pork.
Was there any trouble with the tomato paste?
No, I've always eaten tomatoes and I've never had any problems before.
Have you ever taken anything for the stomach pain?
I've tried Alka-Seltzer and Mylanta, and they sometimes help a little, but I think it doesn't last for long.
So you're not on any other regular medications?
I take some aspirin from time to time, but I try to avoid medications as much as possible. I've always done my utmost to use only herbal or natural remedies, especially for problems that I consider minor. I really think people are taking too much medication these days.
Okay, I understand. But when you did take the aspirin, did it have any influence on your stomach?
Not that I'm aware of. Sorry, I feel like I'm not much help. I just don't typically pay attention to these things unless they really cause me trouble.
Okay. Have you ever had any adverse reaction to any herbal medication?
I did try eating a lot of raw cabbage as it was recommended by a friend, but all it seemed to do was give me a tremendous amount of gas and in fact made my stomach feel worse. Perhaps I just ate too much?
Too much of anything is never a good cure.
Now look at question 8. Take notes on the details of the doctor's examination.
What I'd like to do now is just examine your belly, if I may. Just lay back and try to relax your tummy muscles. So when I touch around this area, do you feel any discomfort?
Not really, no. Just a little gassy.
Your tummy is nice and soft, which is good, but there doesn't seem to be any pain associated with pressure. A little bit of gas is normal when you press firmly around the area, but no sign of tenderness or anything sinister.
Now look at question 9. Take notes on the suggested initial tests.
So I guess the first step we need to take is that I'll take a sample of your feces in order to check for any type of parasite. Considering you have recently travelled to Thailand, and even though you remained within the hotel the majority of the time, I'd still like to rule it out.
But all the travel guides say that if you only eat hotel food, it's extremely unlikely to get ill.
It definitely lowers the chance, but you can pick up a parasite in any country, even here. It can be as easy as not washing leafy vegetables thoroughly. There are many ways in which they can enter your body.
Oh, okay. That's kind of scary.
Well, as I said, it's just one possibility that I'd like to rule out. Apart from this, I'd also like to do an FOBT, or fecal occult blood test. It's a very simple test that is taken from 2 stool samples and checks for blood in the stool that is not visually apparent.
Is that really necessary? I thought that was only checking for cancer.
As you mentioned that there has been a change in colour, I'd just like to check. Many times there is no visual evidence of red or black colouring in the stool, so therefore an examination can give us a more concrete finding. There is one other examination I will recommend. It's a very simple test called a barium test, which involves having a kind of X-ray of the abdominal area. This will enable us to examine your upper gastrointestinal region.
Now look at question 10. Take notes on the details of the testing procedures, further tests, and Mary's concerns.
So this barium test, it's just an X-ray?
Firstly, you would need to drink a thick substance, which doesn't taste particularly nice, I must admit, but it allows the radiologist to see very clearly the workings of your stomach. Sometimes they give you an injection through an IV, which just helps with the cramping feeling and can provide a better result. The radiographer will ask you to move into various positions, but the whole test is relatively easy and only takes around 20 minutes to finish.
And this test, will it be the final test I have to have?
Well, look, this test will tell us if the pain is coming from the stomach or perhaps the gallbladder. It can also indicate if it is the result of an ulcer. Now I need to explain to you that an X-ray of the upper intestine does not always detect an ulcer or other irritations. So if the pain persists afterwards, I would recommend you for an endoscopy, which is where a specialist inserts a slender tube through your mouth or nose. Think of this as like a flexible telescope, and it's possible through this type of procedure to diagnose a multitude of complications. It's very effective.
I guess my main worry is that, well, it sounds very invasive.
I realise this type of procedure sounds very daunting, however, they anaesthetise the area beforehand, and you actually don't feel any discomfort at all. I've actually had this procedure myself, and it's really not as scary as you may think.
Okay, well, I guess if I have no other choice.
All of these tests are simply to get to the bottom of the discomfort that you've been experiencing. The sooner we can begin these tests, the sooner you'll feel back to your old self.
I think it has a lot to do with the anaesthetic. I had an auntie who died during an operation.
Although it's an invasive procedure, you'll be awake the whole time, so I assure you, the only anaesthetic that you will be given is simply used as a numbing agent.
Now look at question 11. Take notes on Mary's recommended dietary plan.
Do you have any questions as of yet?
No, not so far, no. Oh, well, actually, yes. Will I be able to continue my regular diet up until I have the test?
That's a good question, Mary. It's very important to try to follow a healthy diet. That doesn't mean changing or altering completely your life, but it involves small steps that hopefully you'll be able to manage and gradually increase as time goes on. The hardest thing about a diet is sticking to it, so that's why I recommend small stages of change. What I'd like you to do now is stay away from the greasy food that you've become accustomed to. Also avoid eating near to bedtime because this may cause more acidity. I would highly recommend that you avoid any food that is spicy or too salty. I would suggest very bland, plain food, and always drink plenty of water. You may have to consider changing your diet. Nothing radical, just increasing the green, leafy vegetables, as well as trying to either introduce fruit to your everyday diet or increase the amount you eat. You will see and feel the benefits from even a small change.
I guess I could do that.
Now look at question 12. Take notes on the doctor's follow-up instructions.
Okay then. Well, I'll give you some more information about the test so we can get things underway.
Occupational English test. Listening test. This test has two parts. Part B. In this part of the test, you will hear a talk on eating disorders. You will hear the talk once only in sections. As you listen, you must answer the questions in the spaces provided on the answer paper. Turn over now and look quickly through Part B. You have 1 minute to do this. You may write as you listen, and there will be pauses during the talk for you to complete your answers and to read the following questions. Remember, you will hear the tape once only, and you should write as you listen. Now read question 1. Question 1 has been done for you.
Today's discussion is on the often controversial topic of eating disorders, the various types as well as the telltale signs and symptoms that often go unnoticed by family, friends, and associates. I will also discuss the more common treatment plans arising from what can only be described as a difficult to diagnose illness, even for our most experienced healthcare professionals.
Now read question 2. Now listen and answer question 2.
An eating disorder is an illness that causes serious disturbances to your everyday diet, such as eating extremely small amounts of food or severely overeating. A person with an eating disorder may have started out just eating smaller or larger amounts of food, but at some point the urge to eat less or more spiraled out of control. Severe distress or concern about body weight or shape may also signal an eating disorder. Common eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder.
Now read question 3. Now listen and answer question 3.
Researchers are finding that eating disorders are caused by a complex interaction of genetic, biological, behavioral, psychological, and social factors. But many questions still need answers. Researchers are using the latest in technology and science to better understand eating disorders. One approach involves the study of human genes. Researchers are studying various combinations of genes to determine if any DNA variations are linked to the risk of developing eating disorders. Neuroimaging studies are also providing a better understanding of eating disorders and possible treatments. One study showed different patterns of brain activity between women with bulimia nervosa and healthy women. Using functional magnetic resonance imaging, researchers were able to see the differences in brain activity while the women performed a task that involves self-regulation, a task that requires overcoming an automatic or impulsive response. Psychotherapy interventions are also being studied. One such study of adolescents found that more adolescents with bulimia nervosa recovered after receiving Maudsley model family-based treatment than those receiving supportive psychotherapy that did not specifically address the eating disorder. Researchers are studying questions about behavior, genetics, and brain function to better understand risk factors, identify biological markers, and develop specific psychotherapies and medications that can target areas in the brain that control eating behavior. Neuroimaging and genetic studies may provide clues for how each person may respond to specific treatments for these medical illnesses.
Now read question 4. Now listen and answer question 4.
Many people with anorexia nervosa see themselves as overweight, even when they are clearly underweight. Eating, food, and weight control become obsessions. People with anorexia nervosa typically weigh themselves repeatedly, portion food carefully, and eat very small quantities of only certain foods. Some people with anorexia nervosa may also engage in binge eating, followed by extreme dieting, excessive exercise, self-induced vomiting, and/or misuse of laxatives, diuretics, or enemas. Anorexia nervosa displays many symptoms, especially in its early stages. An anorexic person may suffer from extreme thinness, a relentless pursuit of thinness, and unwillingness to maintain a normal or healthy weight, an intense fear of gaining weight, distorted body image, a lack of menstruation among girls and women, and an extremely restricted eating pattern. Further symptoms often develop over time, including thinning of the bones, brittle hair and nails, dry and yellowish skin, growth of fine hair all over the body, mild anemia and muscle wasting and weakness, severe constipation, damage to the structure and function of the heart, brain damage, multi-organ failure, a drop in internal body temperature, lethargy, and infertility.
Now read question 5. Now listen and answer question 5.
Patients with bulimia nervosa have recurrent and frequent episodes of eating unusually large amounts of food and feeling a lack of control over these episodes. This binge eating is followed by behavior that compensates for the overeating, such as forced vomiting, excessive use of laxatives or diuretics, fasting, excessive exercise, or a combination of these behaviors. Unlike anorexia nervosa, people with bulimia nervosa usually maintain what is considered a healthy or normal weight, while some are slightly overweight. But like people with anorexia nervosa, they often fear gaining weight, want desperately to lose weight, and are intensely unhappy with their body size and shape. Usually, bulimic behavior is done secretly because it is often accompanied by feelings of disgust or shame. The binge eating and purging cycle happens anywhere from several times a week to many times a day. There are a number of other symptoms related to bulimia, including the chronic inflammation of the throat, swollen salivary glands, dental problems, acid reflux disorder, and other gastrointestinal problems, severe dehydration, and electrolyte imbalances.
Now read question 6. Now listen and answer question 6.
There are other types of eating disorders, such as binge eating disorder, where a person loses control over his or her eating. Unlike bulimia nervosa, periods of binge eating are not followed by purging, excessive exercise, or fasting. As a result, people with such a disorder are often overweight or obese. Those people who are obese are at a higher risk for developing cardiovascular disease and high blood pressure. They also experience guilt, shame, and distress about their binge eating, which can in turn lead to more of the same. Eating disorders frequently appear during the teen years or young adulthood, but may also develop during childhood or later in life. It is unknown how many adults and children suffer with other serious, significant eating disorders, including one category of eating disorders called eating disorders not otherwise specified, or EDNOS. EDNOS includes eating disorders that do not meet the criteria for anorexia or bulimia nervosa. Binge eating disorder is a type of eating disorder called EDNOS. EDNOS is the most common diagnosis among people who seek treatment.
Now read question 7. Now listen and answer question 7.
Like females who have eating disorders, males also have a distorted sense of body image. For some, their symptoms are similar to those seen in females. Others may have muscular dysmorphia, a type of disorder marked by an extreme concern with becoming more muscular. Unlike girls with eating disorders who mostly want to lose weight, some boys with muscle dysmorphia see themselves as smaller than they really are and want to gain weight or bulk up. Men and boys are more likely to use steroids or other dangerous drugs to increase muscle mass. Although males with eating disorders exhibit the same signs and symptoms as females, they are less likely to be diagnosed with what is often considered a female disorder. More research is needed to understand the unique features of these disorders among males.
Now read question 8. Now listen and answer question 8.
Diagnosis and treatment is essential. Eating disorders are real, treatable medical illnesses. They frequently coexist with other illnesses such as depression, substance abuse, or anxiety disorders. Some symptoms can become life-threatening if a person does not receive treatment. People with anorexia nervosa are 18 times more likely to die early compared with people of similar age in the general population. Adequate nutrition, reducing excessive exercise, and stopping purging behaviors are the foundations of treatment. Specific forms of psychotherapy or talk therapy and medication are effective for many eating disorders. However, in more chronic cases, specific treatments have not yet been identified. Treatment plans often are tailored to individual needs and may include individual, group, and/or family psychotherapy, medical care and monitoring, nutritional counseling, as well as medications. Some patients may also need to be hospitalized to treat problems caused by malnutrition or to ensure that they eat enough if they are very underweight.
Now read question 9. Now listen and answer question 9.
Treatment for each type of disorder may require a different approach and plan. Treating anorexia nervosa involves three components: restoring the person to a healthy weight, treating the psychological issues related to the eating disorder, and reducing or eliminating behaviors or thoughts that lead to insufficient eating and preventing relapse. Some research suggests that the use of medications such as antidepressants, antipsychotics, or mood stabilizers may be modestly effective in treating patients with anorexia nervosa. These medications may help resolve mood and anxiety symptoms that often occur along with anorexia nervosa. It is not clear whether antidepressants can prevent some weight-restored patients with anorexia nervosa from relapsing. Although research is still ongoing, no medication yet has shown to be effective in helping someone gain weight to reach a normal level. Different forms of psychotherapy can help address the psychological reasons for the illness. With the Maudsley approach, parents of adolescents with anorexia nervosa assume responsibility for feeding their child. This approach appears to be very effective in helping people gain weight and improve eating habits and moods. Shown to be effective in case studies and clinical trials, the Maudsley approach is discussed in some guidelines and studies for treating eating disorders in younger, non-chronic patients.
Now read question 10. Now listen and answer question 10.
As with anorexia nervosa, treatment for bulimia nervosa often involves a combination of options and depends upon the needs of the individual. To reduce or eliminate binge eating and purging behaviors, a patient may undergo nutritional counseling and psychotherapy, especially cognitive behavioral therapy, otherwise known as CBT, or be prescribed medication. CBT helps the person focus on his or her current problems and how to solve them. The therapist helps the patient learn how to identify distorted or unhelpful thinking patterns, recognize and change inaccurate beliefs, relate to others in more positive ways, and change behaviors accordingly. CBT that is tailored to treat bulimia nervosa is effective in changing binge eating and purging behaviors and eating attitudes. Therapy may be individual or group-based. Some antidepressants, such as Prozac, may help patients who also have depression or anxiety. Prozac also appears to help reduce binge eating and purging behaviors, reduce the chance of relapse, and improve eating attitudes.
That is the end of part B. You now have 2 minutes to check your answers.